Back. Now, in war-ravaged Ukraine, the need for aid is growing as more and more people flee their homes. Doctors Without Borders are stepping up their response, reaching into neighbouring countries to assist refugees there. To tell us more about what's happening on the ground, we're now joined by project coordinator Dr. Khalid Elsheikh Ahmedana, all the way from Kyiv in the Ukraine. Doc, thank you so much for your time and good morning to you. How's the work going in Ukraine? I know it's not just only in the country, but also in neighbouring countries where you do have presence and doing all you can to assist. But how's that those relief efforts rather going?
Good morning, everybody. As MSF, we are now in Kharkiv, and we have been distributed in many cities around Ukraine and also in neighboring countries in Romania and in Poland and Moldova. So for the time being in Kharkiv project, we are trying to assist people who are living in the metro stations for more than 1 month. There are many people are living in different subway stations, and those people have been assisted by many NGOs. MSF trying to, many local NGOs, and MSF is trying to provide medical care and medical services by setting a clinic and mobile clinic in the subway stations. However, there is another area which we try to support some of the hospital when we find a gap, and we give some kind of training in mass casualty in the event of a high number of patients, how doctors they can receive. For the time being, we are a team of a surgeon and anesthetist, and we have more team coming in for mental health support, psychologist and clinical counselor, plus some doctors might be arriving. However, the situation is a little bit difficult to have more staff in the ground.
Right. And so far, in terms of that number of staff that you've had to send out in the Ukraine, how many would you quantify to be at this point?
For the time being, I don't have exactly the number. There's some team working in the train, providing some evacuation and medical evacuations from the area around the east. So I don't have the exactly figures so far, but it is going on for a while.
Yeah, I'm sure there's been a shortage of medical supplies there as well. Just take me through how much of medical supplies, training that you've also had to conduct during this very difficult period in Ukraine.
So in overall MSF, we are trying to supply medical supply for some of the hospitals in front line and some of the hospital in some of the city. And this is it's in collaborations with local and network and doctors in the ground. So far, the supply is going on. We receive almost about a huge quantity of medications, but not only medications. It's also non-food items for some populations around city and isolated area.
Right. Doc, you also mentioned that you're working obviously under extreme difficult, circumstances. Take me through your own even personal, experiences here in terms of how difficult it is to operate, relief in a war-torn region such as Ukraine at this point, trying to get medical supplies across and trying to work with a team. However, you just never know if more and more people are going to come while you're still trying to help the many that already are in need of this medical attention.
Yeah, that's a very good question. The more difficulties now is if I give an example of Kharkiv on a daily basis, is that it's continuous shelling during the day and night, and there's some area, of course, that is not accessible. So and is need to evaluate day by day and time by time. Yeah. And you have an alert frequently during the day. So this is one of the difficulties, how to access populations. There are some population have been left under the shelter outside in the city, outside of the subway stations. They are living there. So we try to reach them. But the security situation due to the bombing explosion and the shelling, it's not helping day to day. So it's high risk. However, we try to do the best, and when there's some windows or the possibility to reach and also to meet with the authorities and with the network and with the volunteer in order to collaborate and to have better overview of the need.
Yeah, and while you do try to assist, are you safe? Do you feel safe yourselves while you're also trying to reach out and assist and help medically in Ukraine?
I think there is no play. I mean, it's safe. Safe. It is a little bit difficult word to say at the moment. You never predict when the shelling or bombing or explosion it will be happen. However, the front line also is not so far from where we are living, and so the security it is a major issue regarding the matter what you ask. So far at night, for example, we sleep on the basement of the building because it's heavy shelling and bombing around in the city and around the city.
Yeah, one can imagine such extremely difficult circumstances you're operating under, Doc. But thank you so much for speaking to us this morning, giving us a picture of what you're going through and the efforts that you're trying to, of course, bring there to the UK, and at least in terms of medical relief to not only the Ukraine but other neighbouring countries. Doctors Without Borders Project Coordinator Dr. Khalid Elsheikh Ahmedana joining us, of course, all the way from Ukraine.